Greetings and welcome to the Cancer Interviews podcast. I'm your host, Bruce Morton. And on Cancer Interviews, we chronicle the journeys of cancer survivors. On this segment, our guest is on a cancer journey, but hers is a bit different from all other guests we have heard from because she was diagnosed at age 4. She is Santana Campobasso of Pretoria, South Africa, and we're going to hear about how she survived brain cancer. So now let's get started. And Santana, welcome to Cancer Interviews.
Thank you, Bruce. Thank you so much for having me. Warm greetings from South Africa.
Wonderful. And you are our first guest from South Africa and the continent of Africa. Santana, first thing we want to do is the same thing we do at the beginning of any of our interviews, and that's our attempt at personalizing our guest, getting to know a little bit more about you and your life exclusive of your cancer journey. So if you would, tell us a little bit about where you're from, what you do for work, and when you're not working, when you have some free time, what do you like to do with your leisure time? Stuff like that.
Okay, fantastic. Okay, so I'm Santana, as you know. I live in Pretoria, South Africa. It's usually very hot here. And I'm a hairdresser. I've got my own business. I've had my business for 7 years. And for fun, I'm actually a belly dancer, and I also help a lot with the cancer organization. So yes, that's basically my life in a nutshell.
Now, I have to tell you, and I know you're not hearing this for the first time, you have a first name that is a bit unusual, Santana. Tell us the story behind your getting that name. I know you didn't have much of a say-so in terms of what your name was going to be. None of us do at that particular time. But how did you get the name Santana?
Okay, so do you want to hear the PG rated version or the...
Probably.
Never mind.
Yeah, we would probably prefer that. Let's go PG, please.
All right. My father is Italian, and he's been obsessed with Carlos Santana since Lord knows when. And that's, I don't know, like he was completely flabbergasted by Carlos Santana, his music. And yeah, there was an argument between my mom and him, whether my name should be Sade or if it should be Santana. And to be quite frank with you, I'm actually quite glad they went with Santana instead of Sade. But yeah, growing up, it was a very unusual name. But now I'm kind of like honored that I am probably maybe there's actually 2 people in Pretoria that's called Santana. I am one, and then there's another girl by the name of Santana.
The 2 of you don't ever get confused with one another, do you?
No, I actually don't know who she is. I do know that she's one of my clients' best friends.
All right, now I want to move on to your cancer journey, and I have to tell you that we had another guest on the program who survived brain cancer, and he was diagnosed at age 11. He said that he pretty much accepted the diagnosis and the treatment that followed because he just thought, well, I'm sick and I've got to do what the doctor tells me to do. So in your case, you were diagnosed at age 4. I can hardly remember anything that took place in my life at age 4. So I can totally understand if you don't remember much of anything accompanying the diagnosis. But if you do remember anything about the diagnosis and the treatment that followed, what was it?
I just remember like being in the hospital at that age. But I mean, as a 4-year-old, you know you're sick, but you don't really know like what exactly is wrong with you. And you see your parents going through some hardship, and yet you don't even understand why. So for me, like I said, I just knew that I was sick. For my parents, it was a very hard time. But as a child, you've got no recollection of what exactly is going on. So it's completely like different. And from what I can, like I said, from what I can remember is that I was in hospital. I know that I went looking for my dad at a period, and I remember going into the elevator, and my parents were downstairs. I think they were having like lunch, and I just remember going into the elevator, and I was pressing random buttons at the elevator. I wasn't sure as to where I was going. I just know the elevator was going up and down, up and down. And eventually a nurse opened up and she was like, where are you going? And I'm like, I'm looking for my dad. And she's like, don't worry, I'm going to take you back to your bedroom. Your dad has gone out with your mom. So just stay put and your dad will be here shortly. And that's one of the things I remember. Also, I had a very prominent scar. They shaved half my hair off and my cut was like an Alice band because I had brain surgery. So I know that I was picked on, as per se, because of it. And I remember itching a lot because of the scarring. That's about it. That's all I can remember.
Okay, so I suspect that, well, first of all, the treatment of brain cancer obviously is much more complex than going up and down an elevator. So I'm guessing that all or virtually all that you know about your treatment regimen and all of its steps and all that stuff is stuff that you were told by your parents. And what did your parents tell you about what treatment entailed?
My mother told me, like when I was at an age of understanding, that I went for radiation and that I went for a brain surgery that took about approximately 8 hours long. That's all I can tell you. That's what she told me. And she also said it was a very difficult time for her and my father. They didn't expect me to survive. I think my survival rate at that point was very low. But that's so far what I've been told, but there are many points to my story as well.
So it was a very difficult time for them, but for just about everybody who has a cancer journey, not everybody, but most people, they have caregivers who could be their parents, they could be their spouse, could be their significant other or just a friend. What was the caregiver role like for your parents?
It was tough, especially with the doctor saying that, like, I was unlikely to survive the procedure. I was unlikely to walk again. I was unlikely to speak again. And the fact that I had to start from scratch. I mean, already as a 4-year-old, you are developing to speak. You've already gotten basically to walk. And I had to repeat that all over again. So that was pretty much a scary journey for them.
So was there much for them to do in the way of caregiving, or in a sense, did they perform a better caregiving role by standing back and leaving more of the treatment to healthcare professionals? They
were like, my mom was a first-time parent. My father had 4 kids prior to that, but I mean, the severity of what I went through, no one is really prepared for that. So you are going to have to rely on a healthcare professional to tell you exactly what to do and what to prepare for.
Now, at some point, obviously, you were still in this cancer journey when you became 6 and 7 and 8, that sort of thing. At what point did you become aware of the magnitude of what you were battling?
The scarring, some kids would see the scarring, and also because they knew that I had a brain operation. Kids are mean. Kids are very, very horrible, and they're honest. And at a few occasions, I was told that I was maybe considered stupid. I was bullied because of what I went through, and I had failed the 1st grade. So I had to kind of build myself up and prepare myself for what I was going to have to go through. But children they're very honest. I mean, let's be honest. They are super honest, but at the same time, they were very mean. I do recall that there was one exam that I aced with flying colors. And one girl said to me, how the hell can you basically passed that. You had a brain operation. Technically, you're supposed to be stupid. So yeah, that pretty much like hurt my feelings, but at the same time, I developed backbone.
In one sense, today, now that you're removed from that by years, in that sense, can you consider that a blessing? Not that you had to go through all this, but one of the proceeds of that was gaining backbone.
I definitely have to say 110%. I'm glad that I went through what I went through, because unfortunately life can be very difficult and you need backbone and substance to get through life. So there is no regrets whatsoever. In one hand, I'm grateful for what I went through, because I've got backbone, like I am ready for life and I'm ready for any curveball that is thrown at me, because at the age of 4, how do you know what you're surviving, what you're combating? So yes, no, I definitely, no regrets whatsoever, and definitely feel that this has made me stronger in the long term.
Well, you're right. Kids can be very cruel, and emotionally that can be obviously quite hurtful. But it sounds like you had this lethal 1-2 punch that you were dealing with on an emotional level from your peers, but also on a physical medical level from your cancer journey and dealing this. Of the two, they both sound quite daunting, but which of the two was tougher?
I'd have to say school. School was tough. Like I said, like as a 4-year-old, you have no recollection of what is wrong with you. You just know that you're sick. But where you've got these curveballs being thrown at you at a young age and you have to somewhat develop this backbone, definitely I'd say school was far more worse. Being with peers, it was,
Now, if you like what you hear in this segment, we invite you to subscribe to our podcast by clicking the links below. Once there, you will see a bell icon, and if you click on that, we will notify you when we post a new interview. Now, Santana, at some point, did you get to the other side of the hill with the kids? Did the razzing and the all the unpleasantness with the kids, did that eventually reach a point in which you got past that, or was that something that was just relentless throughout your grade school and middle school years?
It's definitely something I got past, because of like dealing with a brain tumor at such a young age. You basically become a fighter. So anything that is thrown at you, you fight. You have to fight. You have to be made of some sort of substance to be able to live.
No, just because this part was difficult doesn't mean the treatment wasn't difficult. What was the most difficult aspect of the treatment?
I think if I had to ask my parents, I think the recovery directly after the brain surgery, like if I would be able to walk again, if I would be able to talk again, if I would be considered normal again. I think that probably was maybe the hardest thing that I probably had to go through and what my parents had to go through.
Now, as one listens to you today, you sound, in terms of how you speak, you sound like anybody else. How difficult was it to get to that stage? Did you have to work with a speech pathologist, and if so, to what degree?
As far as I'm concerned, yes, I did. The miraculous thing is, prior to the brain surgery, because my father is from Italy, he was teaching me Italian. I was learning to speak English, and my mom has also got Afrikaans in her. So I was also learning to speak Afrikaans. Yet today I can only speak English and Afrikaans, and Italian, unfortunately, is one of the languages I had to neglect. Okay,
but you did reach this point, and I can only guess, though, that it took a lot of work to get you to this point. Is that fair to say?
Yeah. Yes, it did. It did. I do recall that. I know for a fact that I was also in a wheelchair, and yeah, it was very traumatizing for anybody that had to see what I had to go through, especially, you know, as a little girl being that innocent. So yeah, I just think that it was, in terms, I mean, it was a scary period for all of us.
Now, we've talked about your early years with this, but you know, going through, even if you don't go through cancer, teen years, adolescence can be very difficult.
Yeah.
You want to fit in and that sort of thing.
Yeah.
What were your teen years like in terms of your treatment? This is sort of a two-part question. What were your teen years like in terms of your treatment? And what were your teen years like socially now that you had, if you will, a bit of a harder shell?
My teen years were far more easier. I've got a very outspoken personality, and I really don't care what anyone thinks of me. I just think that, like, basically life is short, and I'm here for, you know, I'm here for a good time and not a long time. In terms of school, in high school, yeah, I just developed like this whole, I really don't give a damn. I don't care what you think of me. Also knowing like what I went through, and being at that age to understand that whatever I went through at being a little girl, I went through a hell of a very hard time. So at that point, maybe it's fair to say I felt invincible, maybe arrogant, which is maybe only human nature to feel that way after you know what you survived.
So we talked about your teen years from a social standpoint, but what about treatment? I'm guessing that the scope, the quantity of your treatment tailed off. It decreased a bit with the passage of time. At least I hope it did. But in your teen years, what did treatment consist of?
I just have to go for a CAT scan now every 5 years. In my teen years, I think, no, sorry, correction. At 9 years of age, they found another tumor, which was basically benign. But they basically gave me like chemo pills for treatment. And other than that, throughout high school, I've been very healthy. That there's nothing, no repercussions of what happened to me in the past.
Now, you were diagnosed with brain cancer, and there's obviously more than one type of brain cancer. Just so our audience can reference your brain cancer with some measure of specificity, what type of brain cancer were you diagnosed with?
Geez, if I can, I've been trying to get the name for you. I've just found it in Afrikaans. But it was a type of nasal sinusitis type of cancer. My entire childhood, I've basically had polyps. And from there on, the polyps basically grew into a tumor. And from what I understand, when they discovered the tumor, the doctor thought it was just basically a normal polyp, and then he sent me for a CT scan almost immediately, and then he discovered that the tumor had grown basically on the front part of my head, and that's where I was directly sent into surgery for about 8 hours. But yes, basically polyps. I've been diagnosed with like multiple polyps. And I also had, oh gosh, what do they call it again? Meningitis. Prior to the brain tumor, I was also diagnosed with meningitis, and it was the bacteria that it was some form of a nasal polyp that led to brain tumor, and that's how they discovered it.
So as for the here and now, Santana, to look at you and to listen to you, you look and sound like like the picture of health? Do you feel 100% healthy, or if not 100%, how close?
I feel very healthy. I mean, I'm 32 years of age. Sometimes I wake up and I crack like a glow stick, but I guess that's just with aging. But other than that, no, I'm 110% very healthy. I'm very active. Yeah, no, there's nothing really wrong with me. And if, for example, if I get the cold or if I get the flu, I manage to fight it off. So I know that I've got a fighting spirit.
Our guest is brain cancer survivor Santana Campobasso of Pretoria, South Africa. Her cancer journey is unlike many others in that she was diagnosed at age 4. And getting past that, Santana, anybody who goes on a cancer journey needs some measure of support. And where you are in South Africa, there is an organization that either you have gone to or they have come to you, Cancer Association of South Africa, or its acronym, CANSA. To what degree has CANSA been of help to you, and what does it do?
The thing is, it's not even about cancer helping me. Because I've survived something so miraculous, I decided to give back to my community. And from the age of 16, with knowing what I've gone through and also having a family that battles cancer constantly, I mean, if I had to tell you right now, today, I've received bad news, and my aunt is currently going through lung cancer. And today they also said that it's not long. I have a family that has been wiped out by cancer, and I felt as contribution to what I've survived, it's my only way of giving back. So since the age of 16, I've tried to be a part of a cancer organization. I'm currently the Global Hero of Hope from 2019, and I try and raise awareness for cancer patients and for research by doing shave-a-thons and Cancer Relay for Life, for example. And I also started my own little venture, which is called Courageous Me. That was a thing that I felt I needed to do with the title of being a Global Hero of Hope. So it's, for me, I never tried to make it about me. I never wanted it to be about me. I just want to give it back and give it to the true survivors that have gone through something worse than what I have gone through. Like I've said, I was 4 years old when this happened to me, but I am currently seeing so many people knowing what they're going through. And yeah, it's a different ball game when you see the effects of cancer.
Now, I'd like to hear a little bit more about an event that you organized, and if I have the name of it wrong, simply correct me. But I think it's the Shave-a-thon.
Correct. So yes.
If you would talk to us about its genesis, how it started, and what you're still doing with it now, so people can learn more about that.
Okay, so Shave-a-thon has basically started with the cancer organization. So what we do is we try and get hair donated. We get volunteers to shave off their hair or cut off about, say, 30 centimeters. Then that gets donated to the cancer organization and gets used to make wigs for patients undergoing chemotherapy. And then the shave-a-thon is, if you can't donate your hair, that's fine. Spray your hair for cancer and make some form of contribution towards the Cancer Association of South Africa.
Now, does this go on at a specific time during the year, or can people have their hair sprayed or cut off at a specific time?
If people want to cut their hair, they are more than welcome to. They can cut off their hair any time of the year, but Shave-a-thon is usually hosted in March. That's usually our month for shave-a-thons. And
I have to admit, because I'm I'm lacking a certain familiarity with shave-a-thon, what would you consider to be a good turnout? I mean, in other words, if we got X number of people to participate in shave-a-thon this year, that's a good shave-a-thon. What's a good number for the number of people who participate?
This year, wow. Okay, so far this year, it's been an amazing shave-a-thon. We've gotten, I think, 4 people that donated or cut their hair, and shave-a-thon and spray-a-thon. If they spray their hair, that's always like a give and take. Like, that people are willing to spray their hair for cancer. But so far this last year, we've had a very good turnout considering circumstances. Sure.
All right, Santana, we're going to wrap things up now, and we're going to wrap things up. Even though there's a uniqueness to your journey, there is a sameness to the way we wrap up our interviews. And to some degree, you've already covered what I want you to say. And so some of this you might be repeating, but I think anything that you repeat will be worth repeating. Imagine if you found yourself in a one-on-one situation, a private audience with someone who either had just been diagnosed with brain cancer, or if they were in this interim in which they were told they might be a candidate for diagnosis, but they hadn't been diagnosed yet. And this person, whoever it is probably going to be more than 4 years old. So they're going to have an awareness of what they could be up against, an awareness that you might not have had at age 4. If you were to have a message to that person, if there was one overarching point you would want to make, and you'd want to make sure that you drove that point home so they'd remember it, what would that message be?
To keep on fighting. Just basically keep on fighting. And I mean, the second thing is, sometimes it doesn't mean that it's the end of your story. Sometimes it's a new chapter. And I would think that it's at some point along the way in which you drive home that message, you would just point to your own story and look at the life you're living. You've overcome this, and again, you appear to be the picture of health. And if you can do it, I suspect they can too. Yes? Correct. They can.
Okay, wonderful. Santana, thank you very much for sharing your story. As we've mentioned a couple of times, it is unique in nature in that you were diagnosed at a time in your life different from everybody else we've talked to, not different from everybody with a cancer journey, but certainly different from the people we've spoken to. So Santana, thanks again for sharing so much with us, and thanks for appearing with us on Cancer Interviews.
Thank you so much for having me.
All right, that's going to do it for this segment of Cancer Interviews. We hope that what you heard can aid the cancer journey either for yourself or a loved one. So until next time, we'll see you on down the road.
Thanks for joining us today. For more information, please visit us online at cancerinterviews.com. We appreciate you tuning in, and we'll see you back here again next time on the Cancer Interviews podcast.